So that is why we call it complex hyperplasia. Again, in some cases, you have to look carefully that and rule out a polyp. But more often than not, complex hyperplasia is really complex hyperplasia. Okay, simple hyperplasia may not always be simple hyperplasia if you see the fibrovascular core, kasi pwedeng nakadisguise siya sa polyp. Okay? Or rather, a polyp may be disguised as simple hyperplasia. But normally, polyps do not have the irregularity of a complex hyperplasia. Okay? Now, what is the difference between complex hyperplasia with atypia versus complex hyperplasia without atypia? It's the nucleus of the glands. Okay? The nucleus of the glands, again, di ba proliferative ang pattern, ang basic pattern. So yung proliferative, let's go back to the high power view of a proliferative gland. Yan. Okay? The proliferative nucleus is oval. Okay? Kasi it's compressed, di ba? So it's very oval. But the moment they become round and plump like this, atypia na siya. Okay? And you may even see prominent nucleoli or nucleolus. Tapos lalo na pag nagiging clear yung nucleus, it becomes more visible, it becomes lighter in color. So that's a vesicular shape. Okay, sorry, a vesicular characteristic, meaning nakikita mo yung loob ng nucleus, and therefore the nucleolus and the chromatin become more visible. Okay, that is atypia. Now, how do you distinguish naman complex hyperplasia with atypia from endometrial adenocarcinoma? Simple lang, nawawala yung stroma. So once nag-back to back na yung glands mo, that becomes endometrial adenocarcinoma. Wala na yung stroma. Okay? There are also other things, like through stratification. Ito, nagpa-pile up yung nucleus. Okay? On top of each other. So that's also a sign of endometrial adenocarcinoma. And of course, yung sinasabing cribriform structure, which is glands within glands. Okay? Unfortunately, I don't have a picture of that. Pero suffice it to say, basta na wala na yung stroma, yun na yun, adenocarcinoma na siya. Yung complex hyperplasia, dapat may stroma. Now, this is atrophic endometrium. Nag-atrophy na yung, so nagiging flat or cuboidal yung glandular cells, and the glands themselves become cystically dilated. And you'll notice that the layer of endometrial stroma is very, very thin. Okay, so that is your atrophic endometrium. Any questions at this point before we go to the uterus? Okay, yung uterus, okay, the chief amongst the lesions here is the leiomyoma. Now, the leiomyoma is a lesion derived from smooth muscle. So the only thing that distinguishes it from normal myometrium is the fact that it becomes very well delineated, forms a mass. Okay, but if you're looking at this picture alone, you cannot say that this is a leiomyoma. For all you know, this is normal myometrium. Okay, so unless you see the delineation of the leiomyoma from the normal myometrium, and even that is difficult to pinpoint, you cannot say that it's a leiomyoma. Now, sasabihin sa iyo, this is a mass. in the forming a well-delineated mass in the myometrium. Oh, that's already a myoma. Okay? Now, yung myoma, okay, ano yung characteristic ng myoma? Cigar-shaped nuclei. Tapos, there's hindi masyadong cellular. Okay, hindi siya tawag doon, yung space in between nuclei are hindi masyadong packed. Hindi masyadong maliit. Okay? So, and generally walang atypia. Ano yung atypia dito sa myoma? They would look like that, no? Parang nagiging plump siya. Yan. Okay, parang nagiging plump siya, more rounded. Okay, tumataba siya. Ay, sorry.
Sino mataba mo?
And ito, you'll see a lot. What are these? These are mitotic figures actually. Okay? Yan. This is leiomyosarcoma. Okay? Compared to leiomyoma. You see the difference? Mas plump yung nucleus compared to leiomyoma. Another thing is that it's more cellular. Mas magkakalapit yung mga nuclei. And of course, you can count the mitotic figures here. Yung criteria for leiomyosarcoma, the most important for leiomyosarcoma is the necrosis. Pag meron kang necrosis, tapos yung atypia mo is not that much, and your mitotic rate is not that high, it's still leiomyosarcoma. Kung wala kang necrosis, dapat moderate to severe moderate to marked yung atypia mo, no? And then medyo mas mataas yung mitotic rate. Okay, there's a very nice table in Blaustein, no? But I don't think you need to really know that, no? What's important is that may tatlong criteria for recognizing the difference between leiomyoma from leiomyosarcoma, and that's necrosis, mitotic rate, and nuclear atypia. Okay? Sige. Ito, this is necrosis. Yeah. You see the difference? You can see the nuclei here. Dito wala na. That is necrosis. Okay? Question. Can you see necrosis in leiomyomas? No, you don't. Okay? Oftentimes, what you do see in leiomyomas is called hyalinization. It's not exactly necrosis, no? It's not tumor necrosis, but it's just that it hyalinized, no? It outgrew its blood supply. Okay? So pwedeng you can see something like this, no, but not exactly, no? Parang more homogeneous siya. This one is true necrosis kasi rough yung cytoplasm niya. Talagang wala na eh. Wala ka ng cells. Okay, this is true necrosis, and this is a mark of a tumor. Okay, now let's go to endometrial stromal sarcoma, ESS. Yung ESS, it resembles normal endometrial stroma, but it's invading into the myometrium. And what's more is that you don't see any glands, diba? It's just pure stroma. Okay? Now, it used to be discussed as three types. Meron kayong stromal nodule, tapos yung low-grade na ESS, and then the high-grade ESS. Now, wala na yung high-grade ESS. Yung equivalent dati ng high-grade ESS is now called undifferentiated stromal sarcoma. Okay? Now, the appearance of undifferentiated stromal sarcoma would also look like this. Kinda, no? Less elongated, no? But very atypical. Okay? Sige. And there are times when you cannot distinguish. It's very hard to distinguish between endometrial stromal sarcoma na high grade, na the undifferentiated type, from a leiomyosarcoma. So that's why sometimes we tend to do immunostains. I won't teach you that anymore kasi that's complicated. Okay. Yung clue nyo dito, well, yung clue para sa amin, no, for recognizing endometrial stromal sarcoma is the appearance of these thick-walled arteries. These are actually spiral arterioles. Okay. Yun yung clue namin for differentiating between ESS from leiomyosarc. Now this one is you have an ESS type na pero mas pangit siya because it's more the nuclei are more pleomorphic, but then you also have glandular elements, and sometimes this also would appear to be like a leiomyosarcoma, but the glandular elements will also be here, and the glandular elements are benign. So this is an adenosarcoma. Okay. The adenosarcomas, in terms of age group, adenosarcomas appear at a younger age group. Mga, if I remember right, mga 40s to 50s yon. Yung mga leiomyosarcomas, yung mga 50 to 55, 50 to 60. ESS, parang ganun din, no? Okay? Now, this is carcinosarcoma, or tawag dito triple MT, malignant mixed mesodermal tumor, or malignant mixed Mullerian tumor. Okay? Now, unlike the previous ones that we discussed, yung ESS, the leiomyosarcomas, and the adenosarcomas, ang sabi nila is yung mga malignant mixed Mullerian come from the endometrium rather than from the stroma. Bakit? Kasi if you use immunostains against the epithelial component, which is the cytokeratin, you're using cytokeratin, which is targeting epithelial components, halos lahat, even the stromal component, stains positive. And that's because it seems to be that the stromal component is actually a metaplasia, or a differentiation into stromal elements. So anyway, what is important is that you have a mixture of epithelial component which is malignant, and it takes the form of a poorly differentiated adenocarcinoma, or sometimes, very rarely, poorly differentiated squamous cell carcinoma. Most of the time, it's a poorly differentiated adenocarcinoma. And then at the same time, you have the stromal component, which may be homologous, that will resemble a leiomyosarcoma or an endometrial stromal sarcoma, or it may be heterologous, like a rhabdomyosarcoma, which is derived from skeletal muscle. Or in this particular case, what is this? Chondroid. No, this is like cartilage, no? But it's malignant, so this is a chondrosarcoma. Okay, again, actually, this is kind of common in triple MT. Okay, finding either bone or cartilage. No? Ito yung clue namin sa recognition of triple MT. These are heterologous elements. Okay? And they partially stain for cytokeratin. And then the presentation is usually like a